My name is Carly Iliades. I'm the program head for the neonatal program here at BCIT. So what is neonatal? Neonatal nursing is a subspecialty of nursing that works with newborn infants born with a variety of problems, ranging from prematurity to infections, birth defects, surgical problems, lots of different variety, but they're always newborn infants. Next slide, Julie. So as with the other programs that you've heard about today, this program is very similar. It's for practicing nurses wanting an advanced certificate or to complete their Bachelor of Science in Nursing. We do also have undergrads in our program, and they can currently take the first two theory courses during their BSN. Okay. We do prefer 6 months of relevant work experience in an acute care setting, but that is really just a preference. And we do accept new grads directly into our program. And of course, this program is for people who enjoy working directly with infants and their families and can apply sensitivity and compassion in a really high stress work environment. Okay, next slide. So the neonatal program is designed for nurses who are interested in working in the neonatal intensive care unit. As a neonatal nurse, you would care for premature or sick newborns right from birth up until just discharge from the hospital. The neonatal period is technically considered the first month of life. However, neonatal nurses care for infants from birth until discharge, which can be several months or even up to a year in some really difficult cases. For the most part in the NICU, we care for premature infants, but we also do care for term newborns who have certain risk factors such as infections or congenital anomalies. People who generally enjoy working in this area, obviously usually really like babies, but also really enjoy working with and supporting families. Family-centered care is really at the forefront of what we do. In the NICU, it's also a very fast-paced environment, but it's also very scheduled, and we work in a very methodic and organized way. We look after infants, like I said, ranging from extremely premature infants who are requiring mechanical ventilation, central venous access, multiple medications, right up to babies that we call feeders and growers, who are the babies that are just learning how to feed and just need to grow a little bit before they can go home. Another major focus of neonatal nursing is providing trauma-informed and developmentally supportive care to infants. We've really learned a lot over the past several years about how stressful and traumatic the NICU environment can be for both infants and their families. So our main focus is really providing supportive care to ensure positive neurodevelopmental outcomes. Their brains, these little babies' brains grow so much while they're in the NICU, and the care that we provide as neonatal nurses really does have a tremendous impact on both their long and short-term outcomes. Okay, next slide, please. Again, similar to a lot of the other programs, the neonatal program is a 24-credit program. There are 14 credits of core courses, which are a combination of both theory and clinical. And then there are 10 elective credits. From these elective credits, you can choose from some of our neonatal options, or you can also choose electives from some of the other specialty nursing programs, such as pediatrics, perinatal, breastfeeding, palliative care. There's really lots and lots of different options. And there are also multiple paths to becoming a neonatal nurse. So like I said before, you can take our first 2 theory courses in your undergrad. Then you might do your final preceptorship in the NICU and go straight into working full-time in a NICU after graduation. Or you might finish your BSN, work for a while in another area, and then decide to specialize. So there is, like the other programs, options to take our courses one by one, or else there is the option of the Health Authority sponsored compressed timeframe program. Next slide, please. Again, just some student testimonials. I'll let you guys read that. I think my favorite one is the one about now I have the greatest job ever. I agree with that. The last slide is just my contact information and the contact information of our program assistant. So please don't hesitate to reach out if you have any questions at all. We're happy to answer them. Thank you.